Yes, they have allergy problems all the time. There's four main categories of allergies: environmental, pollens and molds and grasses that they breathe in; food allergies, flea allergies; and contact irritation, for instance, if they were exposed to like fertilizer in the yard or something like that. The most common symptoms of allergies are itching, scratching, chewing, licking on their feet, shaking their head, things like that. The diagnosis really oftentimes is dependent on a pattern. So if they have good times and bad times out of the year, that would be suggestive of something in the environment that comes and goes as the seasons change. So history has a lot to do with the diagnosis. And obviously the symptoms themselves are pretty specific to an allergy problem. By far the most common complication we see from allergy irritation is secondary infection. Either yeast or bacterial infections are most common. The only way that you can find out definitively what it is that is triggering the allergy is through skin allergy testing. Blood tests don't paint an accurate picture, and so for clarity on that question, we typically will refer to our dermatology colleagues, and they will do testing in the patient's skin to find out what they have a direct reaction to. It depends on how severe the allergies are. If they're mild, sometimes over-the-counter antihistamines can provide the relief. Unfortunately, only 15% or so of the pet population out there responds favorably to antihistamines. So more times than not, if the irritation is significant enough, you're going to need the help from your veterinarian to get everything under control. Again, antihistamines over the counter can provide some mild relief. Alternative to that, focus directly on the itching and scratching that they experience. Apoquel is most commonly reached for. There's also an injection called Cytopoint that provides pretty fast, almost immediate relief from itching. Those are the most common allergy medications. Immunotherapy is really a process of desensitizing the patient's body to whatever the instigating allergen is. So based on results from allergy testing, your veterinary dermatologist can formulate this serum that little by little, slowly over time, will make your immune system less sensitive to those environmental factors. And it's really the gold standard of care because it's non-pharmaceutical, and over the long term, for your patient or for your pet, that's definitely the best option. Antihistamines or steroids are what we do to address an allergy reaction. At home, if you notice there's hives, facial swelling, anything like that, Benadryl goes a long way at reversing those effects. But if the reaction is severe, getting to your veterinarian as quickly as possible for more potent therapies, such as steroids, is what would be recommended. I think, and I think every pet owner with an allergy dog thinks theirs is the worst. But I had a little Shih Tzu that was horribly afflicted with allergy problems. We were able to provide control, but that's the key with allergy management. It's a controllable condition, not a curable one. And I know all too well the frustration that comes with having to control a problem like that, as well as the expense that goes along with that control.